Have you ever wondered how your body manages to keep you alive every second of every day, even when you're not thinking about it? Let's dive into one of the body's unsung heroes, the respiratory system. This intricate network is a lifeline, playing a crucial role in our survival. Imagine a bustling city where the lungs are the heart of the metropolis, supported by an intricate highway system, the trachea and bronchi. These roads ferry life-sustaining oxygen to the lungs, where it is then transferred to the blood. But how does this exchange happen? Enter the alveoli, tiny sacs within our lungs, acting like bustling marketplaces where oxygen and carbon dioxide trade places. This complex process, happening without a pause, allows us to breathe and live. The respiratory system, in its elegance, reminds us of the marvel that is the human body. Without the respiratory system, we wouldn't be able to take in oxygen, a vital element for our survival. So how does this system ensure that every cell in your body gets the oxygen it needs? Well, let's dive right in. It all begins when we inhale, drawing air into our bodies through the nose or mouth. This air, rich in oxygen, embarks on an incredible journey down the trachea, also known as the windpipe. This is like the highway of our respiratory system, serving as the main route for air to travel into our lungs. Once the air reaches the lungs, it doesn't just stop there. It continues its journey, moving into a vast network of smaller tubes called bronchi and bronchioles. Think of these as the side streets and alleyways, branching off from the main highway. They guide the air into tiny balloon-like structures called alveoli. Now, alveoli are where the magic happens. Each lung houses about 300 million of these tiny sacs. They are surrounded by a dense network of capillaries, tiny blood vessels thinner than a strand of hair. It's here that oxygen from the air we breathe diffuses through the thin walls of the alveoli and into the bloodstream. Once in the blood, oxygen binds to a molecule called hemoglobin in red blood cells. Hemoglobin acts like a taxi service for oxygen, transporting it throughout the body to where it's needed most. Every cell in our body needs oxygen to produce energy and function properly. So you can imagine how vital this delivery process is. But what about the waste product, carbon dioxide? Well, just as our cells need oxygen, they also produce carbon dioxide as a byproduct. This gas needs to be removed from our bodies to keep things running smoothly. So the process works in reverse. Carbon dioxide diffuses back into the alveoli from the bloodstream. Then when we exhale, it is expelled from our bodies, making room for fresh, oxygen-rich air on our next breath. It's a continuous, efficient process that happens without us even realizing it, keeping us alive and well. But what happens when this finely tuned system doesn't function as it should? Let's delve into the world of common respiratory disorders, such as asthma, bronchitis, and pneumonia, and understand how they disrupt the harmony of our respiratory system. First up is asthma, a chronic condition that inflames and narrows the airways, causing difficulty in breathing. Imagine trying to breathe through a straw. That's how it feels for someone with asthma. Symptoms range from wheezing, shortness of breath, to chest tightness, and coughing. These symptoms can be triggered by allergens, exercise, cold air, or even stress, making the delivery of oxygen to the body a difficult task. Next on the list is bronchitis, an inflammation of the bronchial tubes that carry air to and from the lungs. This condition is usually caused by a viral infection, but can also stem from smoking or inhaling dust and fumes. It manifests as a persistent cough that produces mucus, fatigue, shortness of breath, and even a slight fever. The inflammation of the bronchial tubes makes it harder for oxygen to reach the lungs, thereby impeding its delivery to the rest of the body. Last but not least, we have pneumonia, a serious infection that inflames the air sacs in one or both lungs, filling them with fluid or pus. The symptoms can be mild to severe and include cough with phlegm or pus, fever, chills, and difficulty breathing. This inflammation and fluid make it challenging for oxygen to reach the bloodstream, thus affecting the body's overall oxygen supply. These disorders, while different in their symptoms and causes, all hinder the respiratory system's main function, delivering oxygen to the body. They serve as stark reminders that our bodies are not indestructible, and that maintaining good respiratory health is paramount. Understanding these disorders can help us appreciate the importance of this vital system and the role it plays in our overall health. So next time you take a breath, think about the incredible system that makes it all possible. It's not just about filling your lungs with air, it's a complex dance of processes and structures, all working in harmony. The respiratory system, a marvel of biology, takes in oxygen and expels carbon dioxide, fueling every cell in your body. This process, called respiration, is the essence of life itself. But, like any system, it's not invincible. It can be disrupted by disorders, from the common cold to chronic conditions like asthma and COPD. These complications underscore the importance of understanding and caring for our respiratory health. Yet, in spite of these challenges, every breath we take is a testament to the resilience and complexity of the human body. In every inhale and exhale, there's a story of survival and adaptation. It's a reminder of the miraculous, intricate systems at work within us, keeping us alive and breathing every single moment of our lives.